So in this third section, we're going to be talking about breakthroughs in weight loss that have taken place over the last couple of years. And you and I have been we have a very similar philosophy that we don't want to be the first ones on the bus
Right.
with every new thing. But we don't want to be the last ones on the bus. And I think it's definitely, we've hit a critical mass of data results in our own practice to put this documented into the world to share. We have a new tool in our tool belt. But before we talk about that, Jen, why don't we re-familiarize the listeners to how we think about the three levers that we have in looking at obesity or weight loss strategy. There are really only three levers that we look at, and it makes it very organized to think about. Why don't you break this down?
I love this, and I love how we explain this to our members because I think it's very contextual. I think they get it right out of the gate. But when we talk about these three levers of weight loss, all humans need to be pulling on at least one of these levers to not gain weight, and all three at the same time to lose weight, most likely.
Or at least two.
Or at least two, right.
Yeah.
But I'm pretty aggressive. I say do three.
Go all in, then we can always pull back.
That's right. One, as we already talked about, is calorie restriction. So the amount of food that you're eating.
Just pure volume, the math.
Yep. Because I truly, even though it's calories in, calories out, is not the best context to really talk about weight loss. You still need to be in somewhat of a calorie deficit to induce that. So, limiting the amount of food that you're eating, and then
and to be clear, caloric restriction, you can get there.
Yeah,
it's just hard.
Yeah.
When we talk about caloric restriction being third on our rank, that's from a context of like practical usefulness, reliability, ease of application. Yeah. It's just hard.
Yeah.
You're hungry when you're deprived. And that doesn't usually...
And you're doing math.
And that's exhausting, and decision fatigue and all of those things. So, but caloric restriction is a viable option. It's just hard.
The other thing, the second lever is time restriction. So how often are you eating? For most of our members, we suggest delaying breakfast and just eating 2 meals a day of whole food, eating to satiety, no snacking in between. So, starting your fasting window after the last thing that goes in your mouth in the evening, and then just starting up about 16 hours later, if you can make it that long, 18 to 20 ideally. But a lot of people do really well with this, especially when they get started. And then the quality of the food that you eat. So really it's just, as I just said, subbing out a lot of the processed foods with more whole foods, and trying to make your diet.
And macros.
Yeah.
It's kind of like, this is where you would consider, well, I'm on a high protein or a low carb or keto, high fat.
And find something that's really realistic for you. Like I know a lot of people that start keto, they do great with keto, and then once they get off keto, they can never get back on. It's taking you that far. So let's kind of come up with a different strategy if that's what we need.
But keto, back to why we like to start with the most powerful lever, which is the time restricted eating. If we put the religion on the time and not the diet, diets come and go. And like what's depending on your goals, you might want to eat a different way. You may have different rules. You may have achieved a goal. You may have a goal you're trying to achieve. But if you just live a time restricted kind of lifestyle, it takes a lot of pressure off the what.
Yeah.
And so we have just found that the most powerful lever, if you were to leave one hand on a lever at all times as a human, which every human needs to, or you'll be on a net positive year over year, you have to be paying attention. Like this technique doesn't work for anybody.
Right.
It certainly doesn't work for anybody over 35. Is time restricted window. If you can just adopt a fasting lifestyle, which again, all of human history practiced intermittent fasting, I'm air quoting, prior to mass agriculture at scale in the 1950s. Like even in the 1900s, before mass agriculture was everywhere, and you ate 3 meals a day, you woke up with the sun, you had breakfast around 6, you came home, you ate supper at 5, and you had 12 to 13 hours of fasting every day. Try to get a human in 2022 to not eat for 12 hours, and you're going to think, oh my God, I'm going to starve. I'm like atrophying, or I can't go that long. Like, when did we get that soft?
Yeah.
No, we've survived for thousands and thousands and thousands of years eating between long breaks of nothing. And did quite well.
Yeah.
So we think that the most powerful lever to pull on is time restriction. If that doesn't help you achieve your goal alone, then adding a second lever is going to be very critical. We find that carb restriction, so looking at the kind of macronutrient, the quality of the food, is the next most powerful, and then drilling down even further, the more weight you have to lose or the less time you want to lose it, we find that the quickest way to achieve that goal would be in carb restriction, given the relationship between carbohydrates, blood sugar variation, and insulin resistance with people, especially with metabolic disease. This is the lever to pull on. And if you are in a low carb or a carb restricted kind of dietary thesis woven into a fasted lifestyle, for most people, that's going to get you, if you stay there long enough, you're going to reach your goal.
Yeah.
And then only if you have to, caloric restriction. It's just so hard.
Yeah.
And most people don't like the feeling of starving. I don't.
I don't either.
So that's kind of contextually our thesis around diet. And I can't take credit for that. You know, you and I, we came across one of our Dr. Heroes, Peter Attia, several years ago. He did a little short video, and I was like, oh my gosh, I do this for a living, and I've never heard anybody. It's such a elegant way to think about an otherwise wildly complex situation with the biochemistry, the psychology, the behaviors, all the reasons people eat. But now we're going to talk about the game changer. And I'm going to give you the reins here because this is really something that I love how passionate you are about this. You got onto this faster than I did, probably. I was a little more cautiously optimistic, and now I'm kind of all in on this. This is a new class of medication that was originally and still a diabetic medication, but there are now new indications for non-diabetics to use this medication class of drug with unbelievable results. Take it away, Jen.
Oh, well, I have personal experience with them because, you know, the joke around here is Jen fasting because I would not be the happiest person in the world. And it was hard for me, mostly because I'm insulin resistant. And so my body wants to eat. It wants food. It doesn't really know how to mobilize that stored fat very well. And so stumbled across Ozempic, which is a GLP-1 inhibitor, and just kind of started talking to the rep that came by and told us about it, and started it for myself, and really was a game changer because it helped me fast. It helped me get over that hump of in the morning wanting to eat something. But these drugs are amazing, and there's different types, and there's a couple different versions of them. But the two that are out there now is semaglutide, which is Ozempic and Wegovy, and then liraglutide, I always say it wrong, which is Victoza and Saxenda. So these are both what we call GLP-1 inhibitors, which basically works at the level of your gut. You have incretin hormones in your gut that affect how well your body kind of digests food, how long it stays around in your stomach. Also, at different levels of dosages with these drugs, they cross the blood-brain barrier, which I know we're getting kind of technical, but affects your appetite. So the way they work is, number one, they delay gastric emptying. So if you are trying to eat less food, it doesn't stick around in your stomach very long. No, sticks around in your stomach longer. Sorry. Yeah. So you feel fuller longer, and you don't want to eat a high volume of food. Also really wipes out your appetite. Just,
Yeah.
I mean,
I've never seen an appetite suppressant.
yeah.
And we were in the world of appetite suppressants.
Mm-hmm.
I was actually just having a discussion this morning with my trainer talking about the difference between not being hungry, which appetite suppressants do, and the experience that I'm seeing with patients, which is not that they're not hungry, it's that they get full faster, the satiety.
Mm-hmm.
So like it's creating a subtle but wildly significant difference as opposed to just not eating,
Mm-hmm.
which an appetite suppressant would do. Folks on these medications will have the want to,
Mm-hmm.
and they'll sit down, and then the want to goes away very quickly. So they're starting to experience, for many of them, the very first time in their adult life anyway, where they can push away the plate.
Yep.
And they're learning, oh my gosh, like I don't need to eat this much
Mm-hmm.
for the very first time. It's been so binary, like I either don't have any control or I don't eat. So
Yeah.
I choose don't eat so I can be successful. This is allowing them to get in an arena that is scary,
Mm-hmm.
in total control, and then with some newfound superpower be able to push away the plate. And it reframes in their psychology and their nervous system about what it takes. They're relearning how to eat.
Mm-hmm. They're amazing.
And then they see the results so fast and they're like, more of this, please.
Right.
You know? And so it creates momentum, which I get really excited about because I see the behavior change.
Yeah. Yeah. And they're, the differences between the two, the Victoza and the Saxenda or daily, these are all injections that you give yourself.
Like little baby shots in the
Uh-huh.
subcutaneous
Very,
belly
very,
fat.
very small needle. Saxenda and Victoza are daily.
Mhm.
And then Ozempic and Wegovy are the cousins to semaglutide. They're both the same molecule, all the same molecule.
But they're a once-a-week shot.
Once a week, yeah.
Yeah. And I
So
think
for
most
some
people are moving towards the
Yeah,
once a week, just better compliance.
yeah. It's
I would say
easier
the
to
only way they
manage.
don't work is if you don't take a shot once a week.
Right.
And most people can take a shot once a week.
Yeah. Yeah. Some of the side effects, because all medications
Yep.
have some side effects, are obviously GI side effects. So nausea,
Constipation.
Some people have some abdominal cramping or diarrhea. I mean, it sounds really bad, but we don't have a lot of people that really can't tolerate these.
I think it's generally well tolerated.
Yeah, because the dosing is very subtle. So you do
Titrate
a whole
up.
month of Ozempic or Wegovy at the same dose before you go to the next one.
Mm-hmm.
You can always hang out at a lower dose for longer if you have some of these side effects that are concerning
Yep.
or affecting you. But I love how it's titrated up because, it just helps you kind of tolerate the drugs a little
Yeah,
better.
it helps you acclimate, kind of like to altitude.
Yeah.
Before you really start moving the doses to some of the higher, more efficacious doses.
One of the downsides of these are they're expensive if they're not covered by your insurance plan. I mean, they can be upwards of, $1,500, $1,800 a month. For some of our members, it's well worth it. They pay that, but, they do have some savings programs that you can enroll in. But, I think having a conversation with your physician about these is really, really
Right.
important because, when you and I started in the obesity space, I think bariatric surgery was kind of, while we understood people that chose that route, that was kind of the gold standard of obesity care.
Yep.
If you weren't going to do it with diet and exercise, which some people, they just couldn't do that. And these new drugs that are out are a game changer. Like they equivalent to weight loss with bariatric surgery, I believe.
It's out of this world. Some of the now we don't have long-term data on these, and so stay tuned. This is something that we're going to keep an eye on. But early indicators are that these seem to be very well tolerated. They're incredibly effective to the point where these diabetic medications now have a couple or several FDA indications just for weight loss without diabetes. So this is kind of game changing that a tool like this is now available for somebody who wants to lose weight.
Yeah. And I think the other exciting thing is if you are diabetic and you Ozempic is the FDA approved one for diabetes, Wegovy FDA approved for weight loss. The data on Ozempic for cardiovascular protection is out of this world.
Yeah,
I mean,
that's another.
diabetes and heart disease as we've already talked about in other podcasts, is a 1-to-1.
They're cardiac equivalent.
Cardiac
to have
equivalent.
diabetes is the same thing as to have heart disease. It's because it's all diabetics end up with heart disease, all of them.
Yeah.
And to get we're starving for cardiovascular risk reducers in our diabetics, and we're desperate to make somebody insulin resistant, not diabetic.
Right.
Like, these are all aligned with our North Stars. And so I think I'm really glad that we've got a little bit of information on this class of drugs on record. It more to come. And I think that leaves us with some action steps, Jen. As we always like to do, we throw a lot of information. We want to give folks, listeners, this is really great, but what do I do? I think as we always try to leave this, I think the number one thing is you need to have your team.
Yep.
And if you have a team in place, lean on them. It doesn't do any good to have them and not use them. And if you don't have a team, and I would define your team as a group of healthcare professionals who have created an environment where you are free to have these kind of conversations about options and what's best for you. And if you don't have that, you need to find that is the very thing you need to do today.
Yeah.
Find your team. Thing number 2, I think you would agree with me that just figure out what intermittent fasting means for you. With only a handful of exceptions, I think all adult humans would benefit from a fasted lifestyle.
Yeah.
With, again, just a couple of exceptions to that rule. And lastly, if you've done all of the things that we've talked about and you're pulling on the levers as much as you can, and you are curious about whether a GLP-1 inhibitor would work for you, go to your team and ask. This is absolutely a conversation you need to be having, because it could be the thing that breaks you open.
Yeah.
And really unlocks this for you. And we have helped so many people who just kind of just thought that was their lot.
Yeah.
That they're never going to get a hold of this. And it's a really special thing to unlock that.